guys, it's Dr. Jamie with Pure Chiropractic. I'm here with Dr. Anna and Dr. John. This is our 4th episode of the Pure Perspective podcast. And today we are kind of diving into a little bit of 2 topics, primarily ear infections, because I think we hear a lot about that from parents, but then also tying that back into the immune response and how that's going to affect children, affect parents, affect lives in general. So who wants to take it away to start?
Dr. Anna?
I know that it's all part of the perfect storm. And so like, if there's a lot of stress with birth, one thing leads to another. And typically with a lot of young kids, ear infections are one of those progressive steps that turns into. And that's something that a lot of our patients deal with, and just getting kind of sick, especially around like school time and like the winter time, and their nervous system's not being able to adapt to those stressors. And so we're going to talk about that.
Yeah.
Well, I think like the way I always think about ear infections is the prevalence certainly seems tied to when other illnesses are going on. But I think where people miss the mark is they don't realize that the ears are still part of the lymphatic system and the drainage system. And they're just like the gut, one of the ways that our body will go about detoxing itself. And so if that process is interrupted, if the neurology can't properly control and coordinate that response, then we tend to see these kids with chronic and recurrent ear infections. And the reality is we're not telling you something you don't know, that they're going to end up telling them they need tubes. That probably doesn't really solve the problem for them. A lot of times we see that spin up into additional complaints with headaches and migraines as they get older. We'll see anxiety start to happen for these kids. So
antibiotic overuse.
yeah, it's like it really is that
issues.
slippery slope of just like, that's the starting point, but it should be the starting point to do something different, because the general way things are being done isn't solving the problem at all. It's literally just patching it.
Yeah.
Mm-hmm.
I think one of the best ways we might be able to start the conversation, even from the very beginning, is like, what is an ear infection? Because I think that a lot of parents believe that it's bacteria or a virus that is causing inflammation in the inner ear. There's certainly opportunities for that to happen, but I think just maybe diving into what the components of that makeup is, right? Like the eustachian tube, how it drains, what C1 and C2 can be involved in. Like, I think that could be a good spot where we start and we explain all of that, and then we can even tie it into the Perfect Storm workshop. So if someone feels called to start that, or otherwise I can, it's up to you guys. But
well, I think you're kind of hitting that point, but I think if you go that layer deeper, what we believe in chiropractic is that the brain, the spinal cord, and the nerves controls and coordinates every function in the body. And so whether that's the eustachian tube, the inner ear, how these entities drain, how anything in the body is really made to function correctly, the structure is part of that, but how the body is working around that and the adaptability of the body in general, that's the bigger piece that I think people miss. Is it's not an A equals B situation when it comes to how their body functions. And I think we're not doing a good enough job in society of telling them that it doesn't have to be antibiotics, and it doesn't have to be tubes, and it doesn't have to be changing the status of the region, because if you can improve the functionality of it, then the healing and the recovery that you're looking for ultimately happens naturally on its own.
yeah, absolutely.
Yeah. I know babies are, they're born with their tubes like sideways or horizontal. And a lot of times like they're struggling with those ear infections, and that's what a lot of like medical doctors will say is the problem, when your body's meant and built and designed in that way accordingly. Like it's not made on accident.
wrong.
Yeah. So like a lot of that result in that doctors will put in tubes, and typically over time the body will push those out itself, because that's just not anatomically how we're built. And so that's also
foreign.
where so like if that doesn't work, then it is the antibiotic conversation. And
and when Dr. Anna is saying that, for those of you that are watching, like eustachian tubes sit like this, and then as we get older, they start to narrow downward to drain into our throats. And so one of the other things that we learned from this was from like a ICPA seminar, which is the International Chiropractic Pediatric Association. We learned it through like when babies feeding, if they're breastfeeding, they're lying horizontally, and milk can drain into or get not clogged, but just get stuck in the eustachian tube. And because they're left horizontal, there's no way for them to drain. There's no way for them to drain as well as they should. And so that was part of this seminar, was just learning about different ways that we can help with regulating their nervous system, allowing the body to carry out the same processes that they were created to do. Like you said, we weren't created to have horizontal eustachian tubes up until 6, 7, 8 years old. on accident. Like God didn't create us that way. We
Well,
didn't
and
do that on
if it was a
purpose.
problem because of that, then it would be a
Yeah.
problem for every single kid,
Exactly. And
and
it's
that's
not.
not the case.
It's not. The other side of that too is we see if we're backing it up to the perfect storm like idea, right? So we've mentioned to you now in the first 3 episodes, we've talked briefly about the perfect storm and what that entails. And so when I mean, let's imagine mom goes in, mom's had a stressful pregnancy, mom goes into the hospital because of preeclampsia, right? They're going to induce her or they're going to have an emergency C-section. Now baby's head is being distracted. We're creating tension and irritation at C1, C2 levels, way up top at the ears, way up top just below the ears. And so now we're not seeing that the nervous system can control and communicate to those nerves as well as they should. And the ability to drain and bring out all of that junk, right? Whatever it is that the body is trying to detox out or drain or get rid of, it can't do that. And so then, of course, you're going to be left with a pool of fluid sitting there that's not supposed to be there.
Yeah.
And parents are, I mean, we had a patient in the office. Her son is, I want to say he just turned 3, like within the last 2 weeks. And last year, she called us and was like, hey, I know we were already in this week, but he's coming down with an ear infection. I took him to the pediatrician. Pediatrician's like, yep, we're going to do antibiotics. She said, can I go see my chiropractor first? And if it's still there in a few days, I will do that. And so she called us. She was like, can you guys help? And we were like, of course. And we saw him 2 extra days that week. So we saw him on Monday, probably on like a Wednesday, and then on Saturday. And Saturday, they had their follow up with the pediatrician. And between those adjustments, they went back in and they were like, we don't know what you did, but he doesn't have any irritation. He's not pulling at his ears. He doesn't have a fever. He has nothing that warrants taking those antibiotics. And mom was like, this is a win in my book. This is incredible.
Mm-hmm.
And all we did was adjust C1. It was simple. It's very simple. And it almost feels like it shouldn't be that simple, but it is. And so for parents that are struggling with their kids that are not able to sleep because they're struggling to get comfortable because they can't lay on their side or they've got a fever, so they're sick and they're miserable. This is an alternative that's not going to have negative impacts, right? We're not going to see with the overuse of the antibiotics, we're seeing that the gut microbiome is a disaster. And so now kids' ability to fight off infection excuse me, is way worse. And so when we have those struggles, we're only infiltrating that perfect storm to continue to pile up on that child and cause negative adverse effects, right?
Yeah.
If we can adjust it, A, we're clearing out interference and restoring the body's ability to heal and properly work the way it was created to. And B, we're not adding in those extra things that are going to inevitably cause distress on the nervous system.
Yeah, I think about that. And I'm drawing a blank on his name. I think it was Jacob. But last summer, we were taking care of that little boy, and his mom was literally telling us, "Oh, well, he doesn't go swimming." And we thought it was he didn't know how to swim. And the reality was is she was terrified of his ear infections that he had suffered with since he was born. Every time he would get in a pool, he would end up with an ear infection.
Yeah.
And so as we talk about immune system too, I think about what you just said, and the overuse of antibiotics, I think, goes a step deeper than that. I understand from the medical side of the aisle that the person's in pain, they're in front of them, but we don't know always viral or bacterial. And the antibiotic is traditionally supposed to take care of the bacterial infection. But when we prescribe the antibiotic in a situation where it's a viral infection, one, it does nothing.
Yeah.
Yeah.
And two, it's just leading to the other piece of the puzzle
Yeah.
that you mentioned, which is destruction of the gut. We know that every round of antibiotics has a negative impact on gut for 6 months.
Yeah.
So you think about that for a little child who's had 2, 3, 4 rounds of antibiotics, and now they've got digestive distress, or they're getting sick frequently. It's because their body in its main area of detox has no functional state now.
Yeah.
So it's not as simple as just, oh, they have an ear infection, so we do this. It's the stuff that happens after that
Yeah.
we're trying to get in front of.
Mhm. Yeah, and I think with the perfect storm and all of that stress that's building up, their nervous system is in a state of that sympathetic fight or flight. And so if that is stuck on and that stress is stuck on, then their immune system, which is part of that parasympathetic response, the rest and recover, it will quite literally do everything it's supposed to do in that fight or flight. So it's going to think you're in a fight and not, heal the body. And so whenever we adjust, we're creating that balance within the nervous system. And so their parasympathetics can turn on when they need to and prevent all of this inflammation and
Yeah.
irritation to happen, and also just prevent anything from future happening or them being able to adapt better to that.
And I think it's pretty like in our world, it's pretty simplistic that we always are encouraging people that, especially like when they're not feeling well, when their child's not feeling well, instinctively, I understand, hey, we don't want to leave the house, we don't want to go out, but we usually are begging parents, bring us your child
Best time to
because
go.
that is the best time. Their nervous
Yeah.
system is begging for support, and I think it's almost too simplistic to just go, well, you get adjusted and you get a better immune system. But it's there's layers to that. You get a better immune system because your gut functions correctly, because your brain can better respond. Like what we really want to see when we talk about an immune response with kids that we talk about in the office, and I see it with my own kids all the time, is we want their immune system to respond crazy fast. A fully functioning nervous system should have a massive rise in their immune response. A fast fever, high spike, decrease in activity. They are as lethargic as they've ever been. And then by the next day, it's as if it never happened.
Yeah.
That's how it's supposed to happen. The body should ramp up, fight back, and then calm things down. When your child is stuck in that pattern for days on end, it's basically another warning sign that there's not enough functional status to fight back against whatever they're dealing with.
Well, and the opposite is true also. We had a patient last summer that was with us for an intensive before they had to move or whatever it was. And mom had said that this was the first year in probably 9 or 10 years where she noticed that her child was experiencing actual fevers and coughs and sniffles and things like that where she was saying she's never sick. Like she's almost never sick. And so it's the body being so stuck in that sympathetic dominant state that it's like we don't have the time to be sick. We don't have the opportunity for the body to detox this stressor, this immune response, and have this process be carried out because we are in such a state, logically or illogically, we are in such a state of the body saying we are stuck in stress mode and we don't know how to chill out. We don't know how to calm down from that. We don't have the opportunity to have a day off because we've got the sniffles or because we've got the flu or we've got something bothering our bodies. And so when she started to get adjusted, mom was like, I know that I shouldn't be excited about her having like a stomach bug or something, but she says, I haven't had her be sick in 9 years. And we explained her body was stuck in fight or flight so deeply that until we pulled those layers out and really caused the body to get in that parasympathetic state, it had no way of resting and healing from that. So, that's a little bit more on the immune response side, but I do think it's powerful to see, even for those people who are like, yeah, I don't get sick, I'm so cool, and you're like, you should still be fighting off stuff.
Yeah.
You
Might
should
still
be
be a problem.
able,
Yeah.
yeah.
No, I think that's really, really cool. And it's weird that we celebrate sickness in these kids, but when you have that assessment, you see how stressed out the neurology is, and then you start seeing those pieces first, you're like, this is healing. This
Yeah.
child is healing in front of
Yeah.
us. Yeah, would we choose a different path? Maybe. But ultimately, it's a great indicator that their body is doing a better job
Yeah,
than it did in the
absolutely.
past.
We have
Absolutely.
a colleague, another doc, Dr. Natalie, who always, I feel like it's ingrained in my brain where she always speaks about how being sick is your body's expression of health and how that's an incredible opportunity for the body to be able to heal. And it's a great sign that shows it is healing. Again, we don't want to see that lingering for 10, 12 days, but we also don't want to see that not happening at all. So,
And ultimately,
shout out
like we
to
just
her.
said, it shouldn't. Like
Yeah.
if it's 10 or 12 days, it just shouldn't, right?
Yeah.
Like your body should respond
Yeah.
faster and stronger than that. And if it can't, again, that just speaks to the adaptability of the neurology is not there. And the beautiful thing is that's exactly what the adjustment is going to prime
Exactly.
the neurology for. So
We have Michaela in our office. She used to, for those of you who are practice members, Michaela. She used to work for us. She has 3 awesome kiddos now. And she swears by the fact that when they miss weeks or they miss, like there was a period of time with transitions in life and work that I think they missed maybe like 2 or 3 weeks of their regular visits. And she texted me and was like, Cece has been so sick. I don't know what to do. The only thing I could think of is getting her adjusted, and we get them adjusted regularly. They come in at least once a week for their adjustments and they hardly get sick. She's like, all my mom friends are having this flu bug or this issue or that issue. And we don't suffer from any of that hardly at all because our kids spike a fever. They're good the next day. So, it's
well, I mean,
cool
in the
to see.
neurology, especially at a younger age, like their nervous system is probably working harder day to day than an adult is. And that sounds crazy, but it's just the reality of everything happening in that environment, especially for little ones. It's all brand new.
Yeah.
So you're constantly dealing with the stress within their nervous system of just newness.
Mhm.
It's like, it's no different than when like if an adult goes to a new place, we all feel a little uncomfortable, or most of us feel a little uncomfortable in a new place. Well, imagine that every minute of every day as you're trying to develop all these connections with your world. So it's stressful. And that's where we see the immune system start to tank and the neurology starts to tank. And then the opportunity for all these negative consequences that you can medicate. You absolutely can. You can cover up all those symptoms, but one thing's going to turn into two, and two is going to be four, and it just starts to become a bigger problem from there.
When I
So,
think backing up to talking about how like the birth process affects on C1, C2, that upper cervical region, and if we are medicating and we are masking the problem and we aren't getting to the root cause of what is creating these chronic ear infections or these recurrent ear infections, well, now let's see what that like what does that become in the child moving forward? Okay, well now we've got the kid that's trying to go to preschool and is having temper tantrums or is having ADHD like symptoms where they can't focus, they can't sit because they've got too much noise bringing into the brain that is happening too often. Then you lead to down the road maybe we have headaches or migraines and mom's like, this is weird, he's 8 years old, he shouldn't have headaches or migraines. They go through the ringer with specialists or with pediatricians or with whatever that looks like for them. And then beyond that, you get the 13, 14, 15-year-old who doesn't even want to go to school and is a hermit in their bedrooms because they're depressed. And so that simple adjustment, which is also so complex at the same time, early on at C1, at that very, very start of the nervous system's ability to communicate with the spinal cord, that is so critical in stopping that cascade of what those children might suffer from later on down the road. And I feel like if you're a parent and you're listening and you're like, man, my kid's got ear infections left and right and I don't know what to do about it, regardless of their birth process, if it was a great birth process and they, were a vaginal delivery, a natural birth, no issues, no complications, they still very well could have interference at C1, C2, but especially in those birth processes that were C-section, forceps, vacuum, induction, extraction, like those are chronically ill children that will likely have issues at C1, C2, that upper cervical region, their occiput. And I would strongly advise you to get evaluated for your child, get them some insight scans and get the idea of what their nervous system's going through so that you don't have to ask questions or you don't have to think about this. If you hear it today, I don't want you thinking about it 5 years from now when your kid is depressed or when your kid is ADHD and chronically struggling in school. So just do it today.
proactive.
Yeah, be
I think
proactive.
everything is proactive in what we do. It's just preparing their nervous systems to be the most efficient that they can throughout their life. Just because once this is like going back to like the anatomy of everything, like a lot of times with ear infections, the next step is like removal of tonsils and adenoids, and
Yeah.
nervous system controls all of your organs too. So if your nervous system is so stressed, it can't, send the proper accurate signals to those organs to do what they're made to do, which is filter all of that and boost your immune system. So I think just making sure that we don't have to take those steps and we can kind of go back and, just get their nervous system regulated so they can.
Yeah. I know it seems like tonsillectomies and adenoidectomies are like the quickest fix maybe, or like when you have those recurrent issues, it's the easiest way to say, oh, we're going to remove this so that your child doesn't suffer.
Yeah,
They're
take out the
still going
symptoms.
to have immune responses because those key organs in our body, those key functions of our body, again, weren't put there on accident. They weren't put there to be taken out in the future. Otherwise, every single one of us would do that. And we aren't. But then it diminishes your immune response. You've got so much, just your contact with things in your mouth as a baby. You are putting everything in your mouth, and your adenoids and your tonsils help to fight off bacteria and issues and viruses and things like that. And when you don't have those in there anymore, you lose that layer of defense that helps to protect those other body functions. So
in other words, get those kids checked.
yeah.
If you're in the Livonia area, give us a call, Pure Chiropractic in Livonia. We would love to run those insight scans. Have that conversation. We'll go through those with you. We will show you how we believe we can best help and serve your family so that you don't have to suffer through what we've seen far too many families do, is the constant antibiotics, the ear infections, the sickness, the days lost as a family to these problems is the part that really, as a dad, that one's always on my mind, that you only get so many days with your kids before they leave your house. I'm not willing to give up a single one of them for something that I believe we could have prevented.
Yeah.
So
Absolutely.
bring us those kids.
If you aren't in the Southeast Michigan area, you can also find PX Docs and look on their website. They have a directory. So all of the other offices that do the exact same stuff we do should be listed there, and you can find someone close to you. So that way you're not
It's
not
constantly
getting,
growing too. There's
yeah. So many
more
docs
docs
trying
that
to
are,
learn.
just to help our kids.
I also just realized I kept looking at myself on there instead of you guys over there. So goodbye
Again,
for now.
4 episodes in, we are still learning.
Yeah.
We'll get there. But you guys have an awesome rest of the day. Next episode, we're going to actually talk about something a little bit different on that one. We're going to talk about pain care versus nervous system care. What are the differences? Why we really, really prefer one to the other. Because one of them kind of solves the problem that both have. So we will see you guys on the next one. Have an awesome day.
Bye.